Welcome to a Prevent Connect presentation where we explore the prevention of violence against women. This is a project of the California Coalition Against Sexual Assault. The presentation, 8 Steps to Coalition Building, Fostering Strategic Partnerships to Prevent Violence Against Women, is adapted from the previous Prevent Connect web conference. The materials were developed and originally presented by the Prevention Institute, a national nonprofit organization working to put prevention at the center of community well-being. The Prevention Institute developed the 8 Steps to Coalition Building as a framework for engaging individuals, organizations, and government partners invested in addressing community concerns. Each step provides tips for making collaboration and partnership work more effectively rather than creating new projects or programs. An effective coalition can harness existing resources to develop a unique community approach and achieve results beyond the scope of one single institution or organization. In this presentation, we use the word coalition. That word can mean a number of different things. It can mean a collaboration, an alliance, or a partnership. These terms will be used interchangeably. Many of us have negative experiences with coalitions. They are often time-consuming, frustrating, inefficient, and poorly utilized. Simply put, coalitions are often viewed as a time drain, another meeting that has to be squeezed into a busy day. However, coalitions can be a roadmap to achieving effectiveness and sustainability. Working in a collaborative group means accomplishing a broad range of goals that would not be possible by doing it alone. Coalitions also allow you to broaden buy-in for the outcomes you are trying to achieve by capitalizing on the skills and talents of diverse coalition members who bring different points of view to the table. They also enable you to focus on comprehensive approaches. So let's look at the 8 steps to coalition building. Step 1 is analyzing your program's objectives and determining whether to form a coalition. The steps to do this include clarifying current objectives, examining approaches which might be effective, and assessing current community strengths and needs. Step 2 is recruiting the right people. Having the right people ultimately has an impact on program effectiveness and sustainability. In order to make sure the necessary players are involved, ask the following questions. Who is working on the same issue? Think very broadly and think beyond your standard partners. Who has influence? It is very helpful to have influential partners or their representatives on board as early as possible. Who will be supportive of your issue, and who may put obstacles in your path? It is important to know who your opposition is. Sometimes it may even make sense to invite the opposition to join the coalition if you think their participation in the coalition may inform them enough to turn them into supporters. On the other hand, you also do not want to spend precious time trying to convince others about your position. So you may choose instead to invite a partner who knows how to work with or manage the opposition. Lastly, ask yourself how many people should be involved. You don't want your coalition to be so large that it is unmanageable, but also you don't want to be so small that not enough can be accomplished. Step 3 is establishing the common purpose and, more specifically, setting preliminary objectives and activities for the coalition. While Step 1 examines the objectives of the lead agency, Step 3 is about melding those objectives with the objectives of other members. In this step, the coalition proposes a variety of activities to meet members' needs and skills and identify short-term successes. Once you have determined the right people and set the preliminary objectives, it's time for Step 4. Convene the coalition. What is the best way to convene a coalition? The Prevention Institute believes that the best way to convene a coalition is through a meeting. The notion that members of the coalition will self-select at a conference or workshop to form a viable coalition is wishful thinking. Workshops or conferences can sometimes be used to initiate a coalition. However, they will require more resources than a single meeting and will not produce a carefully selected membership that planned meetings will. Step 5 of effective coalition building is anticipating the necessary resources, which may include extensive staff time for clerical work, meeting planning, preparation and facilitation, membership recruitment, orientation and encouragement, research and data collection, and participation in activities and projects. Estimate how much of the footwork will be the responsibility of the lead agency and how much to realistically expect from members. Anticipate that members will not always fulfill their commitments and be appreciative of what is done rather than moralistic when people cannot accomplish everything they planned. Step 6 is devising an effective coalition structure. Many questions must be considered to meet the specific needs of the coalitions. Should the coalition be ad hoc or ongoing? This depends on the particular situation and needs. How long and frequent should meetings be? Coalitions should not meet more frequently than once a month. When coalitions meet less frequently, members are generally more willing to participate in subcommittees between general meetings. Generally, 1.5 to 2 hour meetings are best. Should agencies officially join the coalition? Generally, do not seek official recognition until the coalition has a clearly defined purpose or specific activities that would be strongly enhanced by the recognition. While official approval may add some clout to the coalition, a more loosely formed coalition will initially minimize the need for bylaws and formal decision-making structure, which can prove cumbersome and pose an early barrier to cooperation. How will decisions be made? Consensus in decision-making is often a good choice. However, this process can become unmanageable. To avoid this, define consensus broadly as an approach that the majority supports and others can live with. Other questions to consider are: how will agendas be structured? How much can members realistically do between meetings? Step 7 is maintain the coalition's vitality. If people stop showing up to the coalition, this is a sure sign of problems. Difficulties generally arise due to poor group dynamics, inadequate membership participation, ineffective coalition activities, and external changes that affect the coalition's mission. So how do we keep a coalition viable? Get on the phone, or better yet, meet the members individually. Meet them for coffee, and especially to talk to the people who are not showing up. Step 8 is making improvements to the coalition through evaluation. This is an important opportunity to get constructive feedback. Components of coalitions that should be evaluated include objectives, activities, processes, and unanticipated events. By assessing the processes, outcomes, and impacts associated with the coalition activities, staff can improve their outreach and coordination skills, and members can determine which strategies help the coalition achieve the ultimate goals most effectively. Sometimes the evaluations may indicate that it is time to dissolve, disband, or change the structure of the coalition. The power of working collaboratively appears only when the individual puzzle pieces or agencies are put together, so a comprehensive picture can truly emerge. The 8 steps are a tool that can help bridge the gap between what coalitions may be and what they should be. Thank you for joining this Prevent Connect presentation. For more information on this topic and for other e-learning units, visit learn.preventconnect.org. Prevent Connect is a national project of the California Coalition Against Sexual Assault and is sponsored by the National Center for Injury Prevention and Control at the United States Centers for Disease Control and Prevention. The views and information provided here do not necessarily represent the official views of the United States government, the CDC, or CalCASA. For more information and resources about the prevention of sexual and domestic violence, visit preventconnect.org.